We start with this. Staff at the Dr. Pixley Isaka Seme Memorial Hospital in Kwamashu have given the health department 10 days to respond to their demands. Over 100 staff members downed tools calling for an end to their poor working conditions. In fact, some of their grievances include staff shortages, working all day without a lunch break, and staff being demoted without following proper procedure. eNCA's Lethiwe Mdluli reports.
The staff at Dr. Pixley Memorial Hospital have had enough. Over 100 workers picketed outside the hospital, calling for an end to their poor working conditions and other grievances. Speaking to a nurse who has asked to remain anonymous for fear of victimization, she says they are severely understaffed, resulting in them suffering from burnout.
Most people who are specializing, we have lost about 20 years of experience, nurses who are theatre trained. Nurses are not allowed to take lunches as per basic conditions of employment. Nurses, when they have to take lunches, they take it maybe around 4 o'clock.
The nurse says their poor working conditions have started to affect patients.
Patients are affected, especially in departments like theatre, because there are patients who are booked for operations. You'll find that when there's not enough staff, some of the lists have to be cancelled, because there's not enough staff. But the reason why the staff is not here, people are tired. You find that the person is overworked the day before, then the next day they won't come to work, they are sick. Then the patients have to be cancelled. Then you find that a patient in the ward has been waiting for an operation maybe for 5 days.
There are also a number of security-related issues. Staff claim that Kwamashu residents have previously blocked entrances at the hospital, claiming that they stole jobs that belong to locals. A staff member also says that the area itself isn't safe for workers.
Sometimes we deal with gangsters that want to get inside and finish what they've started outside. But when it comes to matters of workers, security officers, 12-hour shift, per month we are working 16 days. That makes it 192. But we only get paid for 160. The other 32 hours, we don't know where they're being taken.
The Public Servants Association is accusing the KwaZulu-Natal Health Department of neglect. The union claims that they've written to the Provincial Health Department but have received no response.
We have seen so many confused patients because they are being redirected to this hospital. It's now it will become overcrowding. We are saying the HOD must have time to visit this institution, as PSA will not allow this situation. We are saying to you, if you don't come back to us in 10 days, expect more from the other institution.
The health department has promised to respond to the demands.
We have to encourage shop stewards that when there are issues, do not take issues personal, raise issues with us. I communicate with your PS in many times. So we are learning for the first time that there are challenges in this institution. So as the Office of Labor Relations now, I am concerned when there are work stoppages like this on things that can be attended.
The PSA says these issues are not unique to this hospital, but an issue across the province. Lethiwe Mdluli, Kwamashu.